Hello everyone and welcome to our channel, which will be a main source for everything related to the life and health for more lifey life. In today's video we'll be talking about the types of radiation used in medical equipments, how is it working and is there any risk of being exposed to those radiations. For you to understand how those treatment machines and medical equipments are working for your information and knowledge. Radiology is a branch of medical imaging that utilizes various imaging techniques to visualize the internal structures of the body for diagnostic and therapeutic purposes. There are several types of radiology, each utilizing different imaging modalities and techniques. Here are the commonly used types of radiology and their respective uses. 1. X-ray radiology. X-ray radiology, also known as radiography, uses X-rays to create images of the body's internal structures. It is commonly used for detecting fractures, bone abnormalities, and joint dislocations. Diagnosing lung conditions such as pneumonia, tuberculosis, or lung tumors. Evaluating the presence of foreign objects, such as swallowed items or lodged objects. 2. Computed tomography, CT, radiology. CT radiology combines X-rays with computer technology to create detailed cross-sectional images of the body. It is useful for identifying tumors, internal injuries, or abnormalities in the brain, chest, abdomen, pelvis, and other body parts. Guiding biopsies or needle aspirations by providing precise anatomical information. 3. Magnetic resonance imaging, MRI, radiology. MRI radiology uses a strong magnetic field and radio waves to generate detailed images of the body's internal structures. It is particularly valuable for examining soft tissues, organs, and the nervous system in exceptional detail. Diagnosing brain and spinal cord disorders, joint injuries, abdominal and pelvic conditions, and tumors. Evaluating blood vessels, heart structures, and certain musculoskeletal conditions. 4. Ultrasound radiology. Ultrasound radiology utilizes high-frequency sound waves to create images of organs and tissues. It is commonly employed for examining the abdominal organs, including liver, gallbladder, kidneys, and pancreas. Assessing the uterus, ovaries, prostate, and other reproductive organs. Guiding procedures such as biopsies, needle aspirations, or fluid drainage. 5. Nuclear medicine radiology. Nuclear medicine involves the administration of radioactive substances to diagnose and treat diseases. It includes techniques such as positron emission tomography, PET, scans, utilizes a radioactive tracer to visualize metabolic activity in tissues, aiding in the detection of cancer, brain disorders, and cardiac conditions. Single photon emission computed tomography, SPECT, utilizes a radioactive tracer to provide three-dimensional images, particularly helpful in evaluating cardiovascular, neurological, and bone disorders. Each type of radiology has its specific uses, benefits, and limitations. The choice of radiological technique depends on the suspected condition, the body part being examined, and the information required for diagnosis or treatment planning. Radiologists, in collaboration with other healthcare professionals, select the most appropriate imaging modality to ensure accurate and effective patient care. While medical imaging and therapies utilizing radiation have numerous benefits, it is important to be aware of the potential risks associated with radiation exposure. The risks vary depending on factors such as the type of radiation, dosage, frequency of exposure, and the individual's age and health condition. Here are some potential risks of radiation exposure. 1. Deterministic effects. Deterministic effects occur when the severity of the effect is directly related to the radiation dose received. These effects have a threshold, meaning they only occur above a certain dose. Examples include skin burns. High doses of radiation can cause skin damage, leading to redness, blistering, and ulcers. Radiation sickness. Acute high-dose radiation exposure can result in symptoms such as nausea, vomiting, fatigue, hair loss, and, in severe cases, organ failure. 2. Stochastic effects. Stochastic effects are probabilistic in nature, meaning they can occur even at low radiation doses. The probability of these effects increases with higher radiation exposure. Examples include cancer risk, Prolonged exposure to ionizing radiation increases the risk of developing certain types of cancer, such as leukemia, thyroid cancer, and breast cancer. Genetic effects. Radiation exposure can potentially cause genetic mutations that may be passed on to future generations. 3. Cumulative effects. Cumulative effects refer to the long-term impact of repeated radiation exposures over time. Even low doses of radiation, when accumulated, can have adverse effects on health. 4. Radiation overexposure. In some cases, errors or equipment malfunctions may result in excessive radiation exposure during medical procedures. Overexposure can cause severe health consequences, including tissue damage and an increased risk of cancer. 5. Radiosensitivity of certain populations. Certain individuals and groups may be more susceptible to the harmful effects of radiation. Children are more sensitive to radiation because their cells divide rapidly, and their bodies are still developing. Pregnant women, the developing fetus is particularly vulnerable to radiation, and precautions are taken to minimize fetal exposure during imaging or therapy. Radiosensitive individuals. Some individuals may have specific genetic conditions or medical conditions that make them more sensitive to radiation. It is essential to note that the benefits of radiation-based medical procedures often outweigh the associated risks when appropriately prescribed and performed. Medical professionals follow strict guidelines and protocols to minimize radiation exposure, including using the lowest necessary dose for accurate diagnosis or treatment. Shielding, distance, and time limitations are also implemented to protect patients and healthcare workers from unnecessary exposure. Radiation safety measures, regulatory guidelines, and quality assurance programs are continually evolving to ensure that radiation-based procedures are performed with utmost care and safety. Patients should communicate openly with their healthcare providers regarding any concerns or questions about radiation risks to make informed decisions about their medical care.